Could he die in his sleep?
Absolutely.
He could?
Yes. And many people do actually die in their sleep for various reasons, and one of them being obstructive sleep apnea.
Welcome to your daily health briefing. I'm Dr. Albert Takem. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. Let me ask you a question. Has anyone ever told you that you snore so loudly that they can't sleep in the same room? Do you wake up exhausted despite getting what should have been a full night's sleep? Have you ever fallen asleep watching television, at work, or worse, while driving? If so, today's conversation could literally save your life. Because what many people dismiss as just snoring may actually be one of the most common and most underdiagnosed medical conditions in America. It's called obstructive sleep apnea. And today I have an expert in sleep medicine, Dr. Naveed Shah, to discuss this. Hi, Dr. Shah.
Hi, good morning.
So why is obstructive sleep apnea such a big problem in America?
Well, it's a big problem all over the world, but in America, there's millions of people with sleep apnea, and basically there's many, because of this metabolic syndrome and the epidemic of obesity, it's quite prevalent as a result in the American population. And as a result of morbidity and mortality, it's an issue not just within their own body, but also affecting others as far as driving and, being sleepy while you're driving. So those kind of external factors as well.
Okay. So let me tell you a story of one of my patients. Guy's 46 years old, on the heavy side, comes in with his wife. And so I'm doing the stop bank questionnaire with him. And his score is like 6/8. And I asked him, so you do snore at night and loudly? And his wife burst out laughing. But his wife also added that not only does he snore, but he does this thing where he looks like he stopped breathing. And then after a few seconds, he starts breathing again. And this happens several times at night. And of course, he denied it because no one ever admits that they snore. But she actually recorded him and she showed me a video of this. So this is a guy who's, working hard, going about his business, living his life, but he doesn't know he has sleep apnea. And this is the first time anybody ever brought it up. So why is sleep apnea so underdiagnosed? Why is there very little awareness about the gravity of the problem?
I think one reason is that, over the years, people are snoring and they just attributed the snoring to that's just the way dad is, or that's just the way the mom is, and we'll just close our ears or go to a different room, and we're not going to really bother about it. But I think the other reason is people don't realize that there is a very serious underlying problem that the snoring is related to, and that's the sleep apnea, and that's what's really related to the morbidities and the mortalities that we see associated with high blood pressure. It's additive to any kind of high blood pressure, diabetes, heart disease, any kind of cerebrovascular disease. So it really becomes kind of an addition to those diseases or those problems. And I think that people just brush it off as snoring, whereas there could be something much more sinister underlying.
Wait, so are you telling me that sleep apnea affects blood pressure, diabetes, strokes, heart disease?
Absolutely. It affects all of those things, and it leads to increased wear and tear on your blood vessels, and it leads to more severe disease, especially if you already have underlying high blood pressure. It can worsen your blood pressure. It can make it harder to manage. Same with diabetes, same with coronary disease, same with cerebrovascular disease. So it really has implications throughout the realm of cardiovascular medicine.
So this is not just an annoyance for the guy's wife it's actually something that puts him at risk for bigger problems.
Absolutely. And as the years go by, those problems really multiply.
Okay. So let's get a little bit into the science, Dr. Shah. What is actually sleep apnea? What does the term even mean?
So sleep, again, you're sleeping, apnea, without breath, so you stop breathing. So basically, these are people that, as they sleep, the back of the airway basically collapses due to several reasons. One of them being obesity, strategic areas where fat is kind of deposited in the back of the throat, the snoring over time causing some instability in air pressures. And so they basically collapse. Some people have anatomical issues. For example, their jaw or their tongue is quite large. They may have big tonsils. They may have large uvulas, the thing that hangs at the back of the throat. And so you have a lot of crowding in the back of your throat. So the air, as it enters, the smaller the airway at the back, the more you're going to have vibrations because of the airway going through there at a certain rate. That causes turbulence, and that causes some snoring. And over time, the walls get weaker and they collapse readily. So basically, the back of your throat is collapsing, and you're stop breathing, and that will bring your oxygen level down. And as a result, your blood pressure will go up because your cortisol shoots up at that time. Your blood pressure goes up, your blood sugar goes up. Your heart initially, the first couple of seconds will be slower, but then it'll speed up. So you have this instability in your heart rate as well. And then you'll have wear and tear on your blood vessels.
Wow. All of that just from snoring.
Yeah. Well, the snoring is associated with the sleep apneas. Now, you can have primary snoring. In other words, you don't have to have the sleep apnea, but most people that do snore also have apneic events.
So let me ask you something else. Why do people actually stop breathing? Right. I can understand that you mentioned that the reduction in the space, basically in the back of the throat, leads to sleep apnea. But then how about this thing the wife was telling me that the patient would do, where he stops breathing and then seems like to choke on himself and then starts breathing again?
Yeah.
What's going on there?
So in obstructive sleep apnea, basically once the airway is collapsed, the only other way to kind of open that airway is to have your diaphragm increased pressure to get your airway open. And so what happens is, in doing that, people have some gasping and choking. So for example, I stop breathing. Now my diaphragm has to generate pressure. In doing that, you start having this kind of gasping or choking to open the airway up. And so it's a lot of internal thoracic pressure being generated by the diaphragm to open the airway up.
So his wife asked me, Doc, could he die in his sleep? I'll throw the question to you.
Yeah.
Could he die in his sleep?
Absolutely.
He could?
Yes. And many people do actually die in their sleep for various reasons, and one of them being obstructive sleep apnea. In other words, if you do have brittle coronary disease, now you're generating intrathoracic pressure, you're increasing your blood pressure, your blood vessels are squeezing, your oxygen level is going down as a result of you not breathing. Wow. Yes, you could have a heart attack and definitely die, yes.
Wow. Okay. I did not know snoring was that serious, but
yeah.
Okay. So what symptoms should the patient type of recognize? Like what should the patient be aware of when they are concerned about sleep apnea?
Well, snoring is number one. About 60% of people that snore do have sleep apnea. That being said, about 40% are snoring but don't really have sleep apnea. Then there's a percentage where the spouse or the partner is recognizing that they do stop breathing. People feel tired during the day. They don't feel refreshed. They don't feel like they got a good night's sleep. And so they may be napping inadvertently at times where they maybe shouldn't be napping. We've all had our dad come home and fall asleep in front of the TV. And so those are not normal behaviors. They have been socially created as norms, but they're really not normal behaviors. When you're taking naps 2-3 hours, despite getting 8 hours or 7 hours of sleep, there's definitely a problem.
Okay. So going back to our patients, so it's really important that people understand that snoring can in and of itself be dangerous. 60% of people you mentioned who snore have sleep apnea, and 40% do snore but they do not have sleep apnea.
Correct.
What do you think we should do as a community, as physicians and as patients to bring this issue to the forefront?
Number one is screening.
Mm-hmm.
And so there's several screening tests. We do the stop bang. There's the Epworth, there's Berlin. There's many, many. As far as the stop bang, that's a very easy 8-point questionnaire. And, if you score a certain amount, for example, 5 or higher, you definitely should get a sleep study. Between 3 and 4, you should consider getting a sleep study. And if you're a 1 or then I think you're okay. But the higher you score on that, the more likelihood that you have sleep apnea.
And so the burden really lies with us primary care doctors who see patients more frequently to really screen for sleep apnea and appropriately refer the patients for testing.
Correct. I mean, especially given it's such overwhelming and wide-reaching scope of how it affects diseases, it really should be screened very early.
And what is the relationship between sleep apnea and obesity?
Yeah. So sleep apnea and obesity, there's several ways that I think that you could kind of relate it. One is, the obvious, where people are tired.
Mm-hmm.
And so their motivation has decreased.
Mm-hmm.
And so they don't really want to exercise.
Mm-hmm.
They'd rather sleep rather than exercise.
Yeah.
The second is that in sleep apnea, you may be sleeping, but you have a lot of micro arousals. In other words, your stages of sleep are going to be lighter, typically not as deep, and so you're not going to be well rested. And studies have shown that you also crave sweets and carbohydrates as a result of that.
Oh, really?
Yeah.
So sleep apnea also makes you have a sweet tooth.
In a sense, yeah. You want more carbohydrates. And insomnia, very similar. So those are two ways that people are less motivated to actually pick themselves up and exercise, and they tend to eat things that are not conducive to weight loss. So those two main ways.
Okay. I have been very educated today, Dr. Shah. All right. So as we wrap up, Dr. Shah, what are 3 things you would like our viewers and listeners to walk away with today when it comes to obstructive sleep apnea?
Yeah, I think the one thing is that don't take snoring as something that just happens, or, my dad did it and nobody really, we just kind of made fun of it. I think that take it seriously and, talk to your doctor, get one of these screening tests and see if you are eligible or you have potential sleep apnea, and then get tested. And then, go over the results with your doctor or with a sleep specialist such as myself and see what are the options for you.
Okay. So number 1, take snoring seriously. Number
Correct.
2, get tested.
Correct.
And number 3, follow the treatment plan from your sleep medicine specialist.
Absolutely.
All right. Thank you, Dr. Shah.
Thank you.
This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Takem, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.